This video is all about bleeding. There are three types of bleed: a capillary bleed, a vein bleed, and an arterial bleed. Capillary bleeds. Capillaries are your smallest vessels, and the capillary bleed can be seen trickling out when we graze our knee. They are often minor bleeds. Vein bleeds. A vein bleed can be seen when we cut ourselves and it will flow out. They can be minor or major. Arterial bleeds. These happen when we sustain injuries in places where the arteries flow near to the surface of the skin. They can sometimes spurt out in time with the heartbeat and are major life-threatening bleeds. When dealing with a minor bleed, hygiene is our priority. Wear gloves, clean the area with water or a wipe, and stick a plaster on to prevent any germs getting into the wound. We treat someone who has a major bleed by initially sitting or lying them down. Then examine. Have a look at the area to see if there are any objects or glass stuck in the wound. If not, then apply pressure continuously for 10 minutes using sterile material like a bandage. Make sure the bandage is tight enough to stop the blood leaving the body, but not so tight that it restricts the blood flow to anywhere else in the body. Wear first aid gloves when dealing with blood and wounds. If someone has an embedded object in the wound, then do not pull it out. This could make the bleeding worse. Pack around it with 2 or more bandages, applying pressure from the sides to stop the bleeding. If someone has a nosebleed, then pinch the soft part of the nose at the bottom constantly for 10 minutes. Get them to tip their head forward slightly, get them to sit down and relax. If the bleeding persists for more than 30 minutes, or they are on anticoagulant drugs like warfarin, then take them to hospital. Nosebleeds are very common and happen due to tiny delicate vessels in the nose getting damaged. Now, if a body part has been amputated, like a finger, call 999. Dress the bleed and keep the amputated part in a plastic bag and keep it clean. Place the bag on ice or a cold pack. Do not put the item directly on water or ice though. To recap, minor bleeds are all about hygiene, and major bleeds are all about getting pressure onto the wound to stop the bleed. Be clean and be safe. Thank you for listening. I hope you found this helpful.